Okay, good morning, good afternoon to everyone joining. We're just going to wait a moment or two to let all the members join, and then we'll get started. Okay, it looks like we've reached a critical mass, and I'm sure people will continue to join, but we'll just go ahead and get started. Good day to all who are joining us, whether it's morning, afternoon, or evening, wherever you are. We're so excited to have you here for what is now our fourth SEICHE Center webinar focused on addressing the health of people who work in and are detained in correctional facilities during the COVID-19 pandemic. Our first webinar focused on innovative strategies to prevent outbreaks during the first peak. Our second focused on prioritizing incarcerated people and correctional staff for COVID-19 vaccines. Our third focused on approaches to ensuring adequate vaccine uptake. And now here we are for our fourth webinar, which is focused on helping us all understand what is known about the health hazards associated with the correctional officer profession, and really where room is for future research and policy work. For those who don't know me, I'm Lisa Puglisi, and I'm an internist here at Yale with a clinical practice focused on caring for people who are returning to the community from incarceration, which means I direct a transitions clinic program here. And I'm also the director of education for the SEICHE Center for Health and Justice here at Yale. It is through our educational work and our COVID-related work that we have come to this topic for this webinar. And really, we seek to understand the broad and far-reaching impacts of mass incarceration on all members of the carceral ecosystem, which have really been made especially obvious during the time of COVID, but have been durable even way before then. And thus, we turn today to correctional workers. Our conversation will focus primarily on correctional officers, but we invite discussion about the health of other correctional workers as well. And we also acknowledge that the full scope of work in correctional systems includes incarcerated people who perform job duties as well. We open the conversation to all of those. Admittedly, we at SEICHE are newer to this space around correctional officer health, but really excited to learn with you all. And I am particularly thrilled to be joined by Dr. Jones Tapia, who will co-moderate this panel with me. I truly cannot think of anyone better to be joined by. Dr. Jones Tapia. Nika Jones Tapia is a clinical psychologist and currently managing director of justice initiatives at Chicago Beyond. She was previously the warden of the Cook County Jail and is known as one of the first psychologists in the nation to lead a correctional facility. During her tenure as warden and in partnership with other Cook County criminal justice system stakeholders, the jail's population was reduced by approximately 20%. So major decarceral efforts during her tenure. But before I turn things over to her, just a few housekeeping items. We want to acknowledge that this event today is co-hosted by our friends and colleagues at the Yale Solomon Center and Amend at UCSF. The Solomon Center for Health Law and Policy at the Yale Law School focuses on the intersection of law and the governance, practice, and business of healthcare, bringing together experts and practitioners to address cutting-edge questions of health law and policy and to train next generation top lawyers, industry leaders, policymakers, and academics. Amend is a public health and human rights focused program that works in prisons and jails to reduce the debilitating health effects of these facilities on residents and staff, while also working with policymakers and community leaders to demand a better new system of accountability and healing with health and human rights at its center. This webinar is being recorded and will be made available online afterwards. Please enter your questions in the Q&A and we will address them and curate them as our talk goes on. Feel free to tweet about what you're learning using our Twitter handle. We couldn't think of a good hashtag for the event, but please feel free to invent one. As always, we also have our webinar translated into Spanish, and I will be assigning Bill Cordero as our interpreter in just a minute. Para escuchar en español, haga clic en interpretación en la esquina inferior derecha, and we will go from there. Dr. Jones-Tapia, over to you.
Thank you, Lisa, and thank you to the entire team at SEICHE Center for this invitation to co-moderate this important discussion. For everyone tuning in for today's webinar, I am joined by an esteemed group of panelists who have experienced and witnessed, I would say, the devastating toll that incarceration and employment in the field of correction specifically has on people and on families and on whole communities. I'm really excited to have this conversation because it's really only recently that we've started to have a more full conversation and acknowledgement that that incarceration impacts staff. Although for decades, people who have been incarcerated and their families and advocates and activists have demanded change in the American carceral system. It's really been these groups that have led the charge to demand that we shift our methods for holding people accountable because they have experienced and recognized the damage that incarceration causes. Now, over the years, I have been a witness, I would say, to the impact of this system from many vantage points. As someone who has been a staff member, as a spouse of a correctional officer, as a family member of a person who's been incarcerated, and as an administrator within the system, what I have witnessed is there is a collective trauma that incarceration has on everyone who touches the system, directly and indirectly. And the hazards of incarceration include physical factors like violence. It includes biological factors like infectious disease. We've seen that most recently with COVID-19. And it includes environmental factors like air quality and exposure to mold. In my work as a psychologist, I have been trained to support an individual's journey towards healing and to help them move beyond what's in front of them to this realm of possibility. And that work, that shift in corrections doesn't come easy, because what I found in my tenure in corrections was that the root of the issue wasn't resolved by a person changing. It required the entire system to change. Everything about American jails and prisons, from entry to training to policies to exit, all of those things cause great harm to every person who exists within it, the people confined within it, and the people who work within it. And it's really important for us as a larger society to fully acknowledge that trauma and the hazards that incarceration inflicts, because lives depend on it, but we can't stop there. We have to then move from acknowledgement to shifting our focus and our energy to actually correcting it. And it was when I stepped away from corrections that I had this space and the support of my colleagues at Chicago Beyond to fully conceptualize what corrective action in this moment could look like. Now, for correctional administrators, we are primarily tasked with safety, right? And traditionally, safety is viewed in its physical manifestation as they keep the gates closed, keep the cell doors locked, handcuff people, make sure the fences are secure. We must acknowledge that real safety, though, being safe and also feeling safe, requires more than physical safety. It requires us to create conditions for all community members inside and outside of correctional facilities to feel protected, to be resilient, and to be whole. That's what we call holistic safety at Chicago Beyond. Holistic safety recognizes the universal experience of trauma and other hazards within correctional institutions, and it challenges us to create space for collective healing, breaking down the barriers created by the us versus them culture that we all know exists within corrections, and instead empowering people with lived experience, staff, as well as people incarcerated, to create an environment where people are well, where people are connected, where people can invest in shared humanity, where we can believe that people will act in a manner that will be beneficial to them and others, and where people have the capacity to determine their own future. And ultimately, we have to fight for a system that I would say elevates accountability over punishment and healing over harm, because like I said before, lives are at stake. Now, in this fight for systemic change, I've had the honor and the privilege of working with many people, most of whom have been formerly incarcerated. And it wasn't until recently that I had the pleasure of meeting and working with Andy Potter and Simon Greer, the founders of One Voice United. They're a national campaign to provide correctional officers and staff with a voice in the conversations about correctional reform and the criminal legal system as a whole. And what I respect most about the work of One Voice United is that they are building a bridge between staff, people incarcerated, and other stakeholders to really develop a more unified approach to the changes that we know are necessary on a systems level. And before I turn it over to Andy and Simon to talk about the field of corrections and some of the challenges that correctional staff and people incarcerated face, I just want to open the audience up to thinking about how each of us plays a role in the action that is needed for this systems level change. You'll hear a lot about the problems that exist, but we hope in today's conversation, you will also hear some of the solutions that have been working well. And as you hear both of those aspects of the conversation, I challenge you to think about how we have played a role in the trauma that exists and how we can also play a role in the corrective action that we know is necessary now. So Andy and Simon, I will turn it over to you to share with us a little more about the field of corrections.
Thanks so much. We appreciate it, and we appreciate being here. I guess, is there a particular way you want me to start this out? We can just start out by using.
Yeah, so let's have Simon share the slides, and we'd love to briefly have a brief description, because there's so many people, different people from different backgrounds on the line, about sort of describing the occupation and who's involved with it in the US, and then kind of talking us through your approach to working with correctional officers, and then we'll pose you some more questions.
Can you see these slides now?
Perfect.
So Andy, can you?
Yep.
So if you want to just start by, we put too many words on this slide, but if you want to just start by walking people through,
yeah,
I think an intro of yourself, and then I can jump into some of the statistics.
Yeah, so my name is Andy Potter. I'm the executive director and the founder of One Voice United, and I've spent about 3 decades working inside of Michigan's prisons and around Michigan's prisons. I've been a corrections officer for most of those 28 years, and I was also the executive director for Michigan Corrections Organization, which represents the corrections officers in Michigan. And I'm going to say a little bit about who these folks are that work inside of corrections facilities in the front lines by starting out by saying that they're the second largest stakeholder in this system. And in some ways, I feel like their voice gets forgotten in the story of corrections and in the reform movement itself. A lot of people assume they know who we are and what we go through because there's an American narrative that falsely informs an ill-informed public notion about who we are. And I've always said that America's fascinated with criminal justice, with police, with corrections for the wrong reasons. They want to see, they turn on TV on all kinds of channels and they see the shield, they see violence, they see punishment, right? And what they don't see, unfortunately, is the untold story of who we really are and what we really want out of the system. That's not who we want to be. That's not how we want to be portrayed. A lot of people come into this line of work not thinking or growing up saying, oh, I just want to be a corrections officer when I grow up. They come into this, like myself, coming from a pretty broken town where industry is left, and they have put a correctional facility there in its place. So it becomes a way for folks to come into the middle class. That was my avenue. That was my path. And I had very few options, and that was one of them. And thinking that if you can come into this line of work and if you can help just one person and make a living and a decent wage with healthcare, I mean, that becomes a part of how you make that decision. And a lot of these folks are part-time firemen, they're coaches, they're community members. They don't have ill will. And that's the way I grew up. And most new employees that I come into contact with, when I get a chance to talk to them, and I talk to a lot of them, I ask them, why are you taking this job? And most of them overwhelmingly say, I took this job because it's a way for me to make some money. And if I can help somebody in the process, this is what I want to do. And whether it's a stepping stone or not, it's the ability to help somebody. But the light in their eyes goes out between the time I talk to them, they go through training, and then they come through those front gates. They're starting to realize that this was a system never designed for success. It was never built on that premises for anyone that comes into contact with it. So I just nutshelled everything that's on that paper there, and probably took longer to say what I said. So go ahead, Simon.
So Andy has worked in corrections for, as he said, almost 3 decades. I haven't. I didn't really know much about what it was like to work as a corrections officer until I met Andy, I guess 6 or 7 years ago now. I, like a lot of Americans, I had seen the movie The Shawshank Redemption, and I basically thought it was true. Like, the people who are incarcerated are the victims, and the villains are the people who work in the prison. That was the bias, frankly, that I carried with me. And then I met Andy, and then I started to meet his members. And the story he just told, you know, if you're from the Upper Peninsula in Michigan, there was mining and there was lumber and timber, and that was all gone. And now there were prisons. And so that's where you went to work. And it's not been easy in those communities. And Andy always says, I hate to call it an industry because it's about humanity, but that's what it was in those towns. It was and so I met hardworking people who, you know, were trying to do the best they could to put food on the table. And they described a reality that I had been privileged not to have to think about. You know, so the first time one of Andy's colleagues said to me, yeah, in a housing unit, it's like 2 of us and 200 incarcerated people. So 100-to-1 ratio. And now there's a lot of ideas that we should do rehabilitation and programming. And they were like, I would like to do that. That'd be awesome. It would be a much better job than the one I have. But at 100-to-1, like, all I can do is fake that we're in control. Like, we just act tough and try to make it look like we're in control, because at any moment, right, 100 people can decide they're going to take this place over. And so that's, that's the life they live. Andy, maybe he'll talk more about this later, but what really stayed with me from one of our first conversations was his description of coming home and wanting to take off his uniform and change and go shower before he saw his family, because he didn't want to be the person, right, the facade he had to put on at work. He didn't want to be that person at home. But in 30 years, if you do something 8 hours a day, and often, as many of you will know, corrections officers these days are being asked to work 16 hours straight, and in some cases, in the worst cases, triple shifts. I mean, you wouldn't want to work at Walmart 24 straight hours, but imagine working in a prison 24 straight hours. It takes over who you are. So it would be unreasonable to think you'd come home and be vulnerable, open-hearted, generous of spirit, compassionate, because that's not what you've been told you need to do all day, every day. So I just wanted to offer very quickly, those are the human sides of the story. I think what we've also been trying to lift up is the numbers, right? It's not just that like Andy had a tough time, it was a hard job, and a couple of other people had a tough time. There are 400,000 or so correctional staff in the country, probably a little more than that. And they suffer with PTSD, mortality rates, heart disease, divorce, suicide, and depression that are at epidemic levels. And I appreciate what Dr. Jones-Tapia said about sort of it coming into more awareness more recently. It's like a crisis that it's hard to fathom how little attention it's gotten. It's like, we don't really want to think about what happens in prison at all, except as Andy said, when it's grotesque, right? But we really don't want to think about the people who work there, right? That and Andy will also say, and shame on corrections unions and members that for not telling their own stories, right? I think we've seen a movement of formerly incarcerated people tell their story, and it's changing the American awareness of what is broken about our system. Corrections officers have been told not to say anything. I think they feel uncomfortable about what they're allowed to say and what they should say. And so they carry around inside this kind of macho tough guy culture, a plaguing set of debilitating conditions. And so just to go through them really fast, corrections officers, custody staff have a 34.1% PTSD rate, right? It's higher than any other profession in the country. It's higher than former military and the police. Rates of depression up at 31%, also higher than any other profession. The ones that really get to me are the suicide and mortality. So there are on average, 3 corrections officers take their own lives every week. It's unfathomable how bad it is and how little attention is being paid. And then if you got nothing else from our presentation, if all you heard from us was this, you give up about 15 years of life expectancy if you work in corrections. Right? That's the simple number. Career in corrections costs you 15 years off your life. It shouldn't be that way. What we often like to talk about, and Andy, maybe you'll want to say more about this before we finish up our presentation here, is that there's a clear expectation that it's a hard environment. There is violence, there's danger. Those things are true. But the stress that corrections officers describe, they knew what they signed up for when it came to there would be tough situations with people who are incarcerated. That's okay, that's part of the job, right? Get that. But the studies that have shown the sense of powerlessness is what really afflicts a corrections officer in terms of their day-to-day control over their environment. And so the sense that they're often seen by people who are incarcerated as all-powerful, right? Because they do have a lot to say over how someone who's incarcerated lives their life. Their own sense is that they are completely powerless, that they're not allowed to make any decisions. They have no autonomy, and they often read in the news about new policies and procedures that will affect how they do their lives and whether they will go home safe at the end of the day. So, Andy, do you want to jump in on that before we wrap ours up?
Yeah, I would just say that I think we spend an awful lot of time trying to defend and justify what we do inside of a correctional facility instead of trying to create a system where we don't have to defend and justify every single thing that comes out. And there should be more transparency around that. There should be more transparency around what takes place and how we do it, because it would provoke more conversation around how we do it better.
So what we know is that corrections officers, when we talk to them, when we've surveyed them, when we've talked to them in private, they feel like things like mental health awareness and stress management are crisis level things that need attention. They feel like post-traumatic stress injury or disorder is also a crisis. They think there needs to be more communication and respect rather than the us versus them. And ultimately, by and large, 85% of them feel like their profession is not respected. So they know it's bad and they don't feel respected. And with that, they don't feel a lot of agency. I think what Andy, and it's a credit to him really, what he has been driving forward is a message that you can't look at the statistics about the violence that happens to people who are incarcerated and the trauma that happens to people who work in prisons and the life expectancy diminishment for both groups and on, the recidivism rates and the staff turnover rates. You can't look at all those things and think they're disconnected, right? You have to say that we're not going to fix one without fixing the other. Ultimately, we have to face that the system is entirely broken. These are the symptoms of it playing out with the two largest stakeholders. And only those two stakeholder groups together stand a chance, not just of doing like pendulum politics, but actually leading to sustainable transformation. And so that's what we've been trying to do at One Voice. And thanks for including us today.
Thank you. Thank you so much, Simon and Andy. And we'll come back to you because we have lots more questions, but thank you for setting the stage from the viewpoint of correctional officers and their concerns. And next, we're going to turn to Stephanie Rawlings, who's the former staff wellness program administrator at the Illinois Department of Correction and just moved to a new job overseeing staff wellness at Florida Department of Children and Families, but will speak to us about her wellness work in her prior job.
Good afternoon or morning, depending on where you are. Thank you for having me. This is a really exciting opportunity to share how we kind of built our staff wellness program from the ground up at the state of Illinois since the end of 2015. So some of the questions that we kind of looked at with regard to what were the needs of the staff and what would a wellness program look like. And we really came back to having a pretty basic two-pronged approach, being proactive and reactive. And it seems a lot of times in the corrections industry, we really lean heavily on the reactive side. And so we wanted to make sure that when we really started approaching what the staff needed working in these environments, that we were really looking at proactive and getting in front of the trauma as it was happening or before it happened, instead of waiting for it to accumulate and then end up in the statistics that Andy and Simon just shared, which we totally have seen reflected in our department statistics as well. So one of the things that we came at with the proactive side of things was we developed a boots on the ground approach where we actually implemented and trained a peer support team at every facility. And we had 30 facilities, and the number of team members were based on the number of employees. So today, the fully staffed team has about 225 peer support team members on the ground at these facilities. These team members are trained in the Jeffrey Mitchell critical incident stress management, if you're familiar with that. There are many different kind of critical incident stress management tools out there. This is the one that we felt works best for us. That we could really kind of tweak to specific correctional scenarios, and that's kind of what we did. We really built these teams and we trained them quarterly. We used, real life scenarios that from reportables and different events that we have responded to. Our team members tell us that is by far the most useful part of their training, because every time they get called into a facility to do a debrief following a critical incident, they say it pretty much plays out pretty textbook to their training. And our staff reports that really assist them kind of in the processing of the trauma. And so that's kind of one of our, proactive being the team on the ground, reactive being the critical incident stress management. One of the other proactive tools that we use with our staff is a curriculum called Corrections Fatigue to Fulfillment from the Desert Waters Correctional Outreach. And this is by far our most popular thing. This is a 2-day kind of resilience building awareness course that really breaks down the corrections, fatigue, stress, and trauma into more manageable, understandable parts. And then it provides solutions for these at the employee level. I think a lot of times we're talking about solutions for wellness at such a high level that employees don't feel like, well, that's something that I can participate in, because that's not at their level. They're not policy writers. They're not legislative work, they're not working with legislative liaisons. They're not high management. And so this course and a lot of our education that we do with staff really focuses on recalibrating their job meaning and breaking things down into smaller pieces so that it's not so overwhelming that I don't have any control over this. It's 100 of them versus 1 of me, and really taking the small wins that, breaking it down into smaller pieces so that they can attach meaning and satisfaction to the work that they're doing. One of the other things that we really had to consider when we were looking at proactive and reactive approaches was a culture of differences. And it's funny because I feel like Andy and Simon just touched on that as well, is that we have parts of our state that are very urban. I mean, we have a few facilities in Chicagoland, and then we do have the prison industry areas, if you will, in the rural parts of the state where you're either farming, mining, or you may be working in a correctional facility. So a lot of our approaches for wellness really have to take into consideration the great culture. I call it the culture chasm, although that's maybe not a great way to describe it, but it really is from one side of the state to the other. The other considerations in culture that we have is we're having a major influx of new, younger staff that are coming in and being taught a different way of looking at things, and education is focused so much more on mental health and treatment and rehabilitation versus those who have been working in our system for 20 plus years who maybe didn't come in, and trying to sell that same package of goods to them as well. The whole idea of like self-care and teaching our cadets, each cadet class, how to address and become aware of those issues ahead of time before they accumulate and you become, fatigued and you end up in some of these statistics that were shared earlier. And so that's been kind of a challenge for us, is gaining that buy-in from our staff. And so a lot of our programs, we try to mix that generational gap, if you will, by approaching things with technology. That is what speaks to the younger generation. So we have a social media wellness page for our staff for them to engage in. We have podcasts. We have staff-produced staff wellness newsletters that they contribute the articles and things that are meaningful to them. And I try to always have kind of that younger voice, that new hire voice, and that, experienced, been in the system for 20 years voice coming at them at the same time, so that everybody feels included and everybody can be part of the conversation on wellness. I think some of the considerations when we look at staff wellness programming, especially effective staff wellness programming, is that there is a major culture of silence. And we know this statistically. The public image has been put out there by the media and or Hollywood, just as Andy and Simon kind of introduced that concept. And so gaining buy-in by getting people to start talking and being aware of the trauma that they face, and then buying into, yeah, this career may be harmful to me. It's taking years off my life, and I'm not the same person I was when I started. That was a really hard sell for us when we implemented our program back in 2016 to 2018. And one of the things that I think we did very well was that we did put that team in the facility, and they were correctional staff. We didn't hire anybody for this. We took their peers who already were buying into this, who were well respected in their facility, and we had them sell it to them every day by being there every day, reinforcing the concepts of wellness every day, talking about trauma every day. And that eventually is what won a lot of our staff over, was that they could see what we were telling them play out in front of them. They just needed somebody maybe to make them aware that that's what they were seeing, make them aware of the fact that this is trauma, that's happening to you, and then normalize the conversation around it afterwards. That it's okay to be bothered by the things that we see and experience inside the walls. And I think that was the biggest hindrance, is that we had some challenges policy-wise in Illinois around making it safe to discuss that trauma. And that was something that we addressed head on, was that we knew that we had policies that deterred wellness participation. There was a huge culture of don't talk or you'll lose your job. Don't take mental health treatment or you'll lose your job. Don't say anything that could put your firearm card in jeopardy because you'll lose your job. And that drastically, we know, contributed to suicide rates, as well as rates of depression and other, substance abuse, all the things. And so we went after that. And as of January 1st, we had legislative protections that went into effect in the Unified Code of Corrections in Illinois to build protections around those who are seeking mental health treatment. That's no longer your automatic exit out of the career. The other thing that I really, and I coach now kind of on the side, consulting with staff on this. I'm sorry, there's a bad thunderstorm going on. You can probably hear that. But one of the things that I constantly, when I'm engaging with other staff wellness people that are in the corrections culture, is that we're not going to take something that we're doing with the offender population and try to sell it to the staff as something for them. That was something that we found out early on when we were implementing our program, that would turn them off immediately. Whatever we did, curriculum-wise, program-wise, whatever we brought to them had to be specifically theirs. We were not going to use, although I'm not saying this doesn't have value, but what I project outward to the staff is that I am not a clinician. I am not a psychologist that was working with the population, and now I'm going to work with the staff. You almost kind of got to be a little undercover about it. I constantly go to my clinicians and I ask for feedback and support on different things that we do, but I don't make a big public demonstration of it because our staff feel like they're being cheated. If we're taking things that we're already purchasing for the population or we're already using for them and we try to turn it on to them. And so I think that was something that is a huge consideration when you're implementing wellness programs for corrections staff, is that in order to gain buy-in, there are things, very specific things that I think have to be done. And so
that's so helpful. Thank you. And I'm hearing a couple themes. One is really like organizational psychology approaches, and another is also policy and legislative protections. And we'll come back to those. So thank you for bringing those up. And really now we've heard about PTSD, we've heard about suicide rates and stress, but that's probably just part of it, right? I mean, it's largely a field that's totally under-researched. And part of our goals here today are to help learn where the areas for additional research and growth are. And that's why we turn to our next guest, Dr. Rose Ricciardelli, who's a professor of sociology and criminology at Memorial University of Newfoundland, vice chair of academic researcher and clinical network advisory committee for the Canadian Institute for Public Safety Research and Treatment. And she is joined by Dr. Marcela Siqueira Casiano of also Memorial University of Newfoundland, holding a PhD in sociology. and she is a postdoctoral research fellow with Dr. Richard Deli. Take it away.
Hi, thank you for having me today. So I'm going to present half of what I intended to because I talked too much and had to cut my slides. But I'm going to talk today about CC work, which is a longitudinal study of Canadian correctional workers' well-being, organizations, roles, and knowledge. And this study started in 2018 and it continues until 2028. And what we do in a nutshell is we follow correctional officers from recruitment to 10 years post-deployment, checking how they change in terms of mental health, well-being, impacts of different policies, and all those contextual factors around the statistics we generate to see sort of, we know, for example, baseline mental health, 4.9% of correctional workers screen positive for a mental disorder. We know if you look at a cross-sectional group of correctional officers with occupational tenure, you're upwards of 60% screening positive for a mental health disorder. So we want to understand the why behind those numbers and how those numbers change. So to give you guys a little bit of a background on correctional systems in Canada, we have federal, provincial, and territorial systems. So there's 14 different systems in Canada. Adult prisoners, they're housed in federal penitentiaries if they are sentenced to more than 2 years in prison. And this is the space in which my study occurs. So this study with my team, we study individuals who are deployed to one of the 43 federal penitentiaries in Canada. Maximum security has a secure perimeter, medium security has a secure perimeter, and our minimum security has no fence. They look like townhouses. Okay, just to give you guys a picture of what our federal system looks like. So you go from a 23-hour lockdown in maximum to cooking your own food with a kitchen in a minimum. Provincial and territorial prisons, jails, detention centers, etc. They hold our remanded prisoners and those sentenced to a maximum of 2 years less a day. And they're mixed in security, but they always have a secure perimeter. So I'm just sending the context just because I am from up north, right? So the longitudinal study, CC work, I'll go directly into speaking about it. So we have a research protocol that was published in the British Medical Journal Open. Why this is relevant is because this work is in partnership with correctional organizations. So in order to increase the transparency of the partners that I'm working with and the organizations as a whole, we have the same criticisms that I already heard Simon speaking to. We published the protocol so everyone knows exactly what we're doing, when we're doing it, and why. So this study has 18 co-investigators. I'll show you why in a second when we get to the next slide, from around the world. We have a research coordinator, a data manager, and about 20 affiliates, including the phenomenal postdoctoral fellow that I'm presenting with today. So how this study came about, in 2017, I sat on a meeting for the Canadian Institute of Public Safety Research and Treatment when we were actually launching the Institute. And there was Correctional Services of Canada, the Union of Canadian Correctional Officers, and the Union of Safety and Justice Employee. And we talked about what we could do moving forward. And one of the things I accidentally said, but it wasn't an accident, but that slipped out of my mouth, was if we really want to know what's going on, we have to stop with the cross-sectional stuff and we need to do a longitudinal study. By March of 2018, without a research proposal, without a full plan, I had an MOU and a service exchange agreement to run this study. And I literally thought, and you guys will see when I get to the next slide, I thought I could do it with a couple research assistants and an Excel file and a tape recorder. So this study, just to be clear, it is funded by Correctional Service Canada, it is funded by UCSF, it is funded by Union of Safety and Justice Employees, and it is funded by the Canadian Institute of Health Research, and my university puts in funding as well. And then we also have other partners and supporters on it. So the objective, our research objective, was to understand how prison work shapes the well-being of federal correctional officers over time, to understand if prison work is inherently associated with operational or occupational stress injuries, including post-traumatic stress injuries. So we want to know how correctional work impacts the health. When we talk about health, it's not just mental health and physical health, it's also social health. Because all three health, if we think of how the World Health Organization defines health, are interrelated and occur in flux with each other. Someone can't have good physical health someone can't have compromised physical health without their mental health being slightly compromised and their social health being compromised, simply because a physical injury can be debilitating. So our research questions, we look at changes in officers' mental health, both self-reported and clinically assessed over time. We look at changes in officers' health knowledge over time, particularly with the different interventions that are being in place within the organization. And we look at factors shaping officers' mental health over time. And that's every policy implication that occurs. I think in the Canadian context, We no longer have segregation. We have structured intervention units. That has happened over the course of the study. We have moved our transgender prisoner placement policies from biology to gender identity, also happened over the course of the study. We have introduced needle exchange programs, and we have safe injection sites. So things are changing rapidly, and all of these changes, these policies impact officers. And what it does by participating in the study, where there are over 400 participants, and giving officers a voice on the front line for the first time, because they're normally breached by confidentiality. So we can get a collective of voices and put forth an impact policy, which I'll talk about. So this is the study. Basically at baseline, so this is when they're doing the correctional training program, which is a very rigorous program. And I can tell you because I completed the correctional training program and got my little honor for doing it in uniform in 2019, moving away from my family for 14 weeks. I can shoot a carbine lying prone and get off headshots, so I'm quite proud of that. And I only got one strike of the over 50 in the program. But during that time when they're doing the correctional training program, we do 2 surveys. One is clinical measures with psychometrics, and one is sociological criminological measures. We do a baseline semi-structured interviews, which I'm a qualitative researcher, it's my bread and butter, where we ask about everything at baseline, and we run the mini psych assessments. So we're doing self-report and clinical assessments to get a comprehensive understanding of their baseline mental health. We're also finding out the context around their mental health, and we're also looking at their experience of other factors such as organizational commitment. Every year, every even year, they do the mental health psych assessments as a survey. Every odd year, they do the non-clinical criminological sociological measures. Every year we do a follow-up interview, and every year we do a clinical evaluation with the mini. So there's 3 sub-projects. They're overseen by a quant committee, a qualitative committee, and a clinical committee. So that's the project in a nutshell. And we do this for 10 years. So these numbers are a little bit lower than they are now, but this just shows you basically where we are in terms of data collection. I know they're a bit off because our recent numbers, we've done 310 clinical assessments, which is far below what's reported here. And we have well over 400 interview participants, which is below what's here. We did have a COVID suspension. I'll talk a bit more about that, but from March 30th, 2020, all the way until January 1st, 2021, we paused our data collection. Then we reinvented policies to continue because we had the support of everyone, the union and the employer, who cared about the mental health and well-being of their staff. So the impacts of COVID-19, we had the pause. We used that pause time because remember I told you this kind of started very rapidly, very quickly without a full-blown proposal. So we used that time to really get everything organized, get everything coding properly, get the data all transcribed, get everything reset and have better policies moving forward because we'd had a couple of years of experience and could figure out sort of the challenges in what we were doing. The restart was totally the support of the union and Correctional Services Canada. It is the only out-of-house research that is going because they believe that it is essential to the mental health and well-being of their staff. Because we also have protocols in place. We have lost participants to death by suicide. Retention, not in the study, but retention in the service is not as high as we'd like it to be. And because of these challenges, we have protocols in place to help people get a better handle on their mental health and to intervene if a suicide ideation is active. So with recruitment, had to change to virtual. Our interviews and minis are now done by phone to reduce our institutional footprint, and the surveys continue online. So the publications, to give you a little bit of insight into work that's come out. We've done a couple papers, they're not both listed here, on transgender prisoner placement policies and the impacts on staff and what that means for moving forward, including fears of being perceived as transphobic because people don't necessarily know what to do. We looked at motivations towards becoming a correctional officer. Findings here is that at recruitment, people overwhelmingly have a rehabilitative orientation and are entering the field to make a difference in someone's life. We look at AM Strength. AM Strength is the training program that's introduced in CTP and also given to all employees. And we look at the impacts and evaluate the impacts and how it and what it's doing for the organization, which is very small but important cultural changes where newer recruits and people in early tenure are talking more about mental health. We have the protocol paper, which I spoke about before, that outlines our protocols. We have an occupational fitness, what people look at in terms of each other, in terms of what makes a person a good correctional officer. One of the things that emerged pre-COVID in our data was fear of infectious disease and the strategies in place. And we put that data forward because it was very timely with the onset of COVID-19. For my ethnographic work, I have 3 papers that have come out. One is about the values and ethics that are taught in when you're doing the program. Another talks about socialization techniques using the work of Van Manen, who did the great fabulous police study that I'm sure everyone's aware of. And another looks at what we call the intervention engagement model. And that is basically the co-response model that CSC is using to put prisoner health as well as security at the center of decision-making. It is exceptionally interesting. It's been drilled into me because every time I did anything, including a decision-based training scenario, I wrote an SOI report about why my actions, where they fall on this model and how I could justify them. And I talk about the legal vulnerabilities that come with the job and the fact that every correctional officer can do everything right, you will be investigated over the course of your career every time there's a aversive incident. Other papers, more about AM strength and wellness programs, how EAP, our employment assistance program, or employer assistance program, works versus doesn't. We talk more about stigmas that are preventing the treatment of mental health care. And these are just a little glimpse in some of the work. We talk about organizational stressors. We talk about how, people enter the field thinking their stress is going to be the prisoners. And then overwhelmingly after a year, they think they know it's the colleagues and management and policies. So all of these things are forthcoming. We also have a carceral geography component to it that is very fun. Outcomes very quickly. So first off, when I was doing the correctional training program, inspired by the trainers and the people around me, wrote a position paper to get correctional officers recognized as first responders in Canada. At the time, the Memorial Grant, which recognizes death, including death by suicide in the line of duty, for any first responders, which at the time was just police, fire, and paramedics, their family could receive up to $300,000 in recognition, not compensation for their sacrifice. This memorial grant, I worked hand in hand with them. It now covers correctional, probation, and parole officers in Canada who are recognized first responders. And if something is to happen to them, which I get to tell them all about, their family receives some sort of supports, which I've been told over and over again to take some stress off of going to work in adverse scenarios. Other outcomes, I chair for the Royal Society of Canada. I'm on their COVID-19 task force, and I chair a working group on prisons and corrections, which does include an American scholar. And in that, we've been able to write policy briefs that include looking at mental health and wellness, perceptions of community and institutional correctional workers, and COVID-19. I actually take my research. I do work in every province and territory pretty well in Canada as well as federally, and I inform their wellness strategies moving forward because I rattle off the list of their rates of psychological mental health disorders among their population and the reasons behind those disorders. I've informed, I'm creating trauma-informed training to go into the CTP, the correctional training program. And that training is not going to be oriented just towards prisoners. That training is oriented towards staff, because we've found that 89 in every 100 persons in our study have experienced adverse childhood traumatic events or other traumatic events before they were in the job. I've also talked to the Gender Secretariat at Correctional Service Canada, and I've worked with them on finding more usable and representative gender placement policy strategies in order to do our best by transgender prisoners while doing our best by our staff and other prisoners alike. So those are just some of the outcomes. And I think that's my 10 minutes. So I'm going to stop there and of course acknowledge the funders, which is the Canadian Institute of Health Research, Correctional Service Canada, Union of Canadian Correctional Officers, Union of Safety Justice Employees, and Memorial University. And that's my email and phone if anyone has any questions. Thank you.
Thank you. And if you and Dr. Cassiano, there's a request for some of the links to the articles you were talking about, can place them in the chat. That would be fantastic. And now comes the, thank you for that. And now comes the really, really fun part where we get to just have an open discussion and welcome our audience to chime in as well. But I'm going to start, as people who have joined these webinars in the past know, we like to ask sort of harder questions, not the fluffy stuff. That's boring. But I think that what we're talking about today is probably just the tip of the iceberg. What we know and what correctional officers have told me is it's called doing your time. Many of our correctional officers have shared with me, your job tour of duty is called doing your time, right? They share air, environment, environmental exposures, extreme temperatures in prisons and jails without adequate temperature control or ventilation, exposure to asbestos. We've seen stuff coming out in the last 5 years around head trauma of incarcerated people and traumatic injury to correctional officers as well. These things are largely uninvestigated. There's very little research on them in general. And certainly Dr. Ricciardelli and Cassiano's approach and collaboration in Canada feels incredibly unique and Canadian. Like, it feels really collaborative. And yet, you know, Andy and Simon, like, that type of thing just doesn't happen here much. As somebody who's tried to connect with local SEIU, you know, or the correctional officer unions, it's not so easy. It's not an easy barrier to crack, right? And some of it is probably historical. Like, many groups have historically bad experiences with researchers, you know, coming in and being quite predatory and not making good on their promises, and you fill in the rest, right? Like, we all know that. And there's something that feels uniquely promoting of silos in the correctional profession. And so I'd love to hear from you, like, how do we, this is just the tip of the iceberg. Like, we're gonna put a link in the chat to a great review that came out just this week on all the stuff that's not investigated, right? That we know very little about. And so the question is, how do we get there? Like, how do we, in the research world and in the legal policy world and the workman comp and in occupational medicine world, make inroads and align ourselves with correctional officers to really get do, you know, experimental trials, like things where you're really looking for causality, more rigorous studies of correctional health. How do we make that happen, acknowledging these cultural divides?
I can answer speaking a little bit. So what you're describing for working in correctional services, any Canadian will say we're pretty well up against the same barriers. And I can say one of the things that, like, I started 10, 11 years ago with one small little exploratory study, not going into the prison, talking to released persons. Then I actually started talking to staff because the prisoners told me that the staff are the ones who really need the help after I'd written a book about prisoners. So then I did and started studying staff. That came directly from the mouths of federal offenders. They told me to turn around, focus on the staff, because if we want to change their time and make it better, we need to get them in better mental health. And so the other thing is, the inroads and building trust takes a long time and patience. And we have to recognize that just because we're researchers, no one has to trust us, and we don't own data. We work collaboratively because we actually, without the stories and the words and the time that everyone puts into filling out and participating in research, we have nothing. So we have no ownership. It should be open for sharing. We should allow different people to take looks at all of it. Of course, there's confidentiality. All these kind of things are exceptionally important. But our data, there's no room for being possessive if we want to make change. And there's so many things to look at. And I find now I get approached to add things to the longitudinal study, to look at issues of diversity, to look at the SIUs, to look at other changing policies. And the big reason that we do all these things is because we built trust, and you build the team in. Like, Marcella's been working with me for a year. She can speak to herself about the experience, but she's building the same trust and will have the same access. So it's about working collaboratively and never getting possessive or feeling like you own a space. And I think that makes the difference. And also, I only do what I say I'm going to do. If I'm straying from what I said I was going to do, I tell them and make sure they're okay with it. And then I report back and actually present my research findings all the way up to the commissioner so that they can implement them for change. So I think those things build trust and make a big difference.
Yeah.
And they help break those barriers down.
That's helpful. Thank you for that. But I also love this comment in here from Connor Bell, Andy and Simon, because it gets back to another component that I didn't mention, was aligning the interests, but which we think here is critical, is aligning the interests of correctional officers and incarcerated people. So Connor mentions having worked in Rikers and having the flag fly at half staff when a correctional officer died, often a young person with heart disease or some other condition related to what they assumed was chronic stress. And at the same time, that flag doesn't fly when an incarcerated person dies, right? So like, let's talk about that schism, both between correctional officers and incarcerated people and correctional officers and researchers, and help us brainstorm.
Yeah, I can just say that just trying to have the conversation in a way that shows where there's places that we have in common or places that we can align. Like, for instance, the food that's served. Everybody has an interest in having good quality food being served. Those kinds of inroads, taking those kinds of steps first to show that we share something that makes sense for both sides, that we should be trying to work together on. That's one conversation, but one of the biggest resistance to that is this. You are trained from day one not to align yourself with folks that are incarcerated. It can be perceived as fraternization. Your credibility comes under fire. So you have to be very careful about how you approach those things. But I think we are making inroads. I think now, through the many conversations that we're having and through the many studies that are being done, there's more trust because there's a little bit more transparency among the studies that are being done. There's still a lot of resistance from governmental agencies to not let that data out for whatever reason there is. We've had many wellness studies done in Michigan. For instance, Stephanie brought up Desert Waters Research, Katerina Spinaris. We worked with her for a long time building data in the state of Michigan. That was funded by the legislature. That was never really released in a way that said, like, look, there's a problem. Let's all come together and find those solutions. The solutions cannot be just top-down driven. These solutions have to be about how you bring those stakeholders together. And that might mean everyone involved come to a place where we can recognize the places that's killing us both. It's killing us all on both sides of things. And what do we do for a solution?
I want to just jump in there and just ask the group to think about this from a correctional administrator perspective. I think many of you, or all of us, have had some interaction with correctional administrators. And as we talk about the hazards of these institutions, of jails and prisons, I wonder, is a great challenge for administrators, the reality that the trauma is so profound that the course of corrective action is going to be very costly. And I wonder how we manage getting that full acknowledgement for what is happening in these systems, how we balance that with, let's say, workers' compensation, especially as we're talking about the injuries that staff contend with in the early death. As a former correctional administrator, I know I was often challenged to think of creative ways to protect staff without fully acknowledging the devastation and the impact to life that I think correctional institutions had. So I would love to hear from the group about how we balance those two things, the acknowledgement of the trauma and the costs associated with that.
Can I jump in and respond to that? Just from our experience, one of the biggest ways that we've been able to address that in Illinois is exactly what Andy just said, is the top-down, bottom-up approach. And how we do that is following a trauma or an incident, or even a lot of smaller incidents that may not need individual responses, is that our administration gives the time, even when everybody's dealing with staffing issues and budget issues and all the time, that never goes away. But one of the things that they did for us was they allow us autonomy with the staff wellness response team to activate team members to other facilities during their shift, during off shifts. They invest in overtime expenses and mileage expenses so that those team members can go to those facilities that have experienced trauma and meet with the staff there and spend time with them. They do post-reliefs so that people can do peer-to-peer conversations with them. They do, if we have a critical incident stress debrief, they do the logistics at the facility to make sure that those individuals that are involved in that incident are able to gather with our team that we send in to facilitate that conversation. And I think that, and I've been told by our staff in surveys and as well as face-to-face feedback, that communicates an investment to them and an acknowledgement of what they're going through by the administration to the workforce. Because we see so many times that we make clinicians and mental health professionals and, you know, physicians, nurses, all the things available to the population. And traditionally, those things are not made available to the staff following the trauma as well. And so I think it does a great job of kind of balancing what you just said, which is like not putting the whole thing on blast, but just it's a very big acknowledgement hat tip to the staff from the administration that they're willing to invest those resources of manpower and the dollars that it costs to take somebody off their post and backfill it for a day or for a couple of hours so that those team members can go help a nearby facility or even go off of their post in their own facility to assist a colleague. And so I think that that's the bottom up, meaning the team, the boots on the ground, the coworkers who are doing the work, but the top down, the administration relieving barriers and investing in the staff and acknowledging that those traumas occur.
If I could jump in for a second, I really appreciate everybody's comments, and I want to pick up on Lisa's suggestion that we try to get to the hardest parts of the conversation. So maybe take a step back. I was thinking about, so why would corrections officers and their unions be resistant? And so I was thinking first, like they basically get blamed and demonized, like all the time up to right now, right? As we're having this conversation, they're getting written up for something or mocked for something or blamed for something. So that's happening. The job is being gutted. Like the health benefits are being cut, the pensions are being cut, the retirement age is being expanded, the wages are losing pace. Like they actually think the things that came with the job are being eroded while more is being put on them. So their real life view is like, no one has much respect for this. I get less than I used to get, and it's getting harder to do. We had a corrections leader who we worked with who said during the pandemic, we went from being essential employees to sacrificial employees. And I think that was the feeling. Like they're essential when it means they have to go to work, but not when it means they could get any kind of extra pay, right? So their feeling is like, really nobody cares. And so I think, Lisa, when you're walking in looking to make that connection, it's up against a room of people who are like, well, we just got to protect our own. And any exposure is going to end up reflecting badly on us. I think what Stephanie said at her first part of the presentation, I think they have to believe they're not getting the collateral benefit of something for someone else, but it's for them, right? So it's not to change them, like they don't get it, right? And if we study them more and talk to them more and train them more, then they'll get it. And now they'll agree with us about how the system should work. Instead, it's like, wow, you work here every day. You know more about this than me. Why don't you tell me what you would do to make this place better for you? And I think that's been so rarely done. Even when like I've had those words come out of my mouth, there's like, nah, you don't really believe that, right? There's just like not a faith that anyone really cares. And then I just want to name, there are real tensions, and this goes to one of the comments in the chat. I think the experience of reform is that it's making, although the promise is it'll be less traumatizing and more safe later, today it looks like I'm going to be less safe today. Like, I don't like putting anyone in a cage, but I don't know what else to do if you don't let me use solitary. And what is your proposal? That later people will stop being vicious and violent. And so they're like, oh, you want to cut funding and put it into the community. Okay, so is that my pension you're cutting? Or is that the number of personnel we have? So I think there's a real no, we don't agree and you don't care about my safety. And so ultimately there's like a risk reward thing. The risk is you want to make these unproven changes that I think will be, the risk for me is it'll be more dangerous. And the reward is something I can't even picture. Like you're promising me something later that is going to help the people who are incarcerated. I believe that's what you value. I don't believe you want to help me, but I don't see what the help will be for me. Like I can't quite picture it, although it sounds nice. What I know is I'm going to feel less safe today because change makes me feel unsafe, because in the past you've taken away tools that I think kept me safe, even though it wasn't holistic safety the way that we all hope it will be. It was like I knew how to work in this system and do my best to keep myself safe. And you keep taking things away, and I don't get things that make me safer or help me see what safety will look like for me. And so I think we continue daily to make them more resistant because they rarely hear or feel this is really for you. It's really going to make your life better. And here's how. And so I don't want to be a downer. I feel like I'm usually the optimist, but I think that's what it looks like to a lot of the officers that I've talked to over the last few years.
To that point, I'm wondering, is there room, in your opinion, to introduce research like the research we just heard from Dr. Ricciardelli to show what the other side of this could look like, not as an endpoint, but as a potential destination point of what they're seeing in Canada, for example, after the changes based on her research? Is there room to introduce what's happening in other countries to American corrections workers to begin to get some of that trust building about what this process could look like?
I couldn't tell if Andy was going to go off mute. I'll just say really quick, we've been running a leadership assembly for 10 of the largest corrections unions in the country. And we brought the 2 Norwegian corrections unions to be partners in it so that they could hear from trade union leaders from Norway what the system is like there and how it works. And this August, we're hoping, if we can raise the money, to take our corrections union leaders, a delegation to Norway to see it, because I think it could spark their imagination for how it could be different. And through the eyes of their trade union brothers and sisters there, feel like these are people who get me, right? They care about me. They value the same things as me, and their lives look better than mine. It looks different. So I think there is a lot of room there. I think it is a question of, well, I think it's starting with, the other thing I just say is, I think starting with wellness has also really helped. Like when you open with like, I don't need to tell you it's killing you. Like, talk to me about the people you work alongside. Is that what you want? Like, are you happy with that? No, you're not. Okay. So what would reform look like if you set the agenda? Right. And then I think there's a lot more appetite, rather than feeling they're protecting something that they know doesn't work. They're being invited to reimagine something they know doesn't work. Andy, I don't know if you want to.
Yeah, can I just add one thing to this? Because there's a lot of conversation around other countries, and especially Scandinavian countries, and how well they do some of the same work as their counterparts here in America. I think you have to acknowledge up front that the society is different, and why we incarcerate in America has to be the question asked. Like, why do we incarcerate in America? Right? And what's the objective? What's the American view of the objective? And that all has to be part of that conversation for our folks to be able to understand the difference in where innovation, where it works. We should just celebrate that, call it out, and embrace it. And where it doesn't work, we should not be afraid to also call that out and say, this is not working. So what's another solution, right? So when we do go to Norway, one of the things we always emphasize is that, look, you're going to see a system, but you're also going to see a different society. So we have to have a balance with that, not to say that there's a lot of things in the Norway system and other systems as well. There's other systems in some of those countries that are great too. But what can we bring back that will work and that can work? And how do we make those frontline staff be stakeholders in that? Like, how do they help shape what their work is going to look like so that when a prison does close, they aren't scared, they can celebrate, because we've also incorporated a pipeline for something a little different, a little better for them. That all has to be sorted through if we really want to break that wall.
I would like to jump in here too, because guys, don't get us wrong. Like Canada, when you look from afar, it looks beautiful. But when you kind of do what we do and you tag those people, those folks, and we interview them longitudinally, we can see that, the situation is just terrible. But I would like to go back to that very first question that you had for Rose about how do we do this? How do we do this partnership? And Rose just gave you half of the story. I'm going to give you the other half. The other half is that Rose, in our team, we care. And Rose leads us in that. We care. She knows everyone. She travels everywhere. She has dinners with everybody. She drinks with everybody. So she knows the people on the ground. The people in prison, everybody knows her. If I need something, she tells me, give a call to so-and-so. He's a correctional manager. Give a call to so-and-so. He's a correctional officer somewhere. She knows everybody. And of course, this is part of her charisma and the way that she is, but it's also part of her caring. So I think that Simon said some word here when he was just discussing right now, we gotta care. And I can feel that all of you guys here, you're people who care. I can get that in the way that you talk, right? So I think caring is a lot of what, when you hear, it's not everybody in Canada who does this kind of research, and not everybody who has this kind of partnership with unions, with the corrections, with all the stakeholders. It's very rare actually to find that. Usually even academics, they're very conflictual. They're very I think Andy, you said something about, I think Andy and also Stephanie, we gotta give them voice. Let people speak for themselves, not just kind of come and, I have a PhD, I'm gonna tell you what you need. I don't know what you need. I don't know what you do. And we as a team there in our little bubble, in our little research, we never assume that. We invite them, we let them speak. And then it's really nice to see, because we go back, we write all those papers, and Rose goes back to the commissioner, who's the big boss, and we present, and even I present, she brings me with her, and we present, saying, look, the situation is awful, what you guys are going to do. And she doesn't leave the room, the Zoom call now, until people tell her what they're going to do, until they tell her, we have a plan. And then she tags along, okay, what's the plan? We want to hear. So for us, that goes back to that very first question, is caring. It's kind of, we are almost on the verge of, I don't want to use that word, but I will use it. It's just you have to harass, the people, the stakeholders, you got to help, you got to jump in and help. People are dying. This is it feels like a war. It's not a war, but it feels so.
Thank you.
And Marcella is super, super kind to me. I'm not as great as she describes. I can guarantee it. She's amazing to work with. But I actually tell my participants that if they participate or not, they might as well get used to seeing me, because I'm basically like a stalker in the prisons. I will show up, I will interview them, I will write about it, I will talk about it, and they got to get used to it. I'm around. But it also creates an avenue which is really helpful when people need something and when things are going really sideways. It doesn't matter if it's on the union side, the employer side, or the participants. It gives you a space to be there. And then I'm always thinking, one of the things we might do, we might not inflict big change with that, but we might prevent a tragedy, right? So it gives a good space. And I wanted to actually mention one of the co-investigators on the project actually got some funding to try to duplicate the CC Work project in the US, and is working towards making that happen. So I just wanted to put that out there.
That's great. Maybe you can share their information in the chat for everyone.
In listening to this, Dr. Castellano, you are absolutely right. This is hard work, but But I also have to say that Simon is right in that, the reality here is that many people who go into corrections are not trained to do hard work. You're trained to otherize people. You're trained to see the other person as a threat so that you can come out safe. People who are incarcerated, they are trained from the moment that they enter into correctional facilities to see the other person, correctional staff, as a threat. And it becomes a survival strategy. And so when we talk about the hard work that is needed to really help people to see themselves in this, to see the harm that is being caused by this us versus them, and to open themselves up to possibilities, we have to encourage people to trust. And that doesn't come easy. And so what I am still not hearing is like what we've heard thus far is like, here are some of the solutions when there are incidents. Here are some of the solutions when we can pinpoint something happening. But what we have said and what we started with in this conversation is that everything about corrections is damaging. And so if we only focus on incidents, are we getting at the root of the problem? And are we helping people to truly see themselves in this work? From my vantage point, it takes all of us to really to think about how this system causes damage, from people incarcerated to staff to correctional administrators, all coming together at the table and assessing that damage and what we can do collectively. Andy, you spoke about this when you said like the important part is bringing the people with lived experience to the table. I couldn't agree with you more. But in bringing people to the table, don't we also have to truly approximate what the damage is so that we can forge a pathway forward? And I'm not sure that I'm hearing us really talk about how we as a collective can do that.
I think one thing that you brought up that is near impossible, and it's the impossible problem, is this notion of trust. I don't think you can get staff to trust other staff. I don't think you can get, and if you can't get that, I don't think you get staff to trust healthcare, and I don't think you get staff in the institutions to trust staff in the community. Everyone is caveated with their trust. And I definitely think it'd be near impossible to start seeing trust build up between the prisoners or the parolees and that. So I think you're bringing up a very important point. And it's very difficult to build trust in an organization that is built on covering your back and knowing that you're strategically vulnerable with everything you do. So I think it's a really difficult, I don't have an answer. It's a really great question. And I wish I had an answer. I don't know how to do that.
I think there's another, that's helpful, Dr. Tridelli, and I think there's another part too, which Andy got to in talking about the Netherlands, which is that it does not have the underlying racism that undergirds our entire carceral system, but is not just unique to people who are incarcerated. Like you mentioned too, Andy, it's where prisons are located, very much defines communities that rely on them for work, that have really very few other options. And some work has shown too, and we know that correctional officers themselves are disproportionately brown and black. And so it gets back to this hard thing, which two people have now mentioned in the chat, which I'm going to bring us back to, like, let's take solitary confinement as the issue, right? And Simon, you mentioned this, right? Like, you're asking a correctional officer to accept a change to policy and practice that makes them immediately feel more at risk, even though there may be sort of down the line benefits. But we also take and layer on that race and racism and bias as still, even though Black and brown people are disproportionately represented amongst officers, it's still the minority of correctional officers, right? So it's largely still a white occupation, overseeing largely non-white population of incarcerated people. And so we layer that on top of it, right? But we know, like Danielle Roods has done work at George Mason showing that even working on solitary like tiers impacts negatively the officers who work on those tiers. And so the question still remains, and I don't think there's an easy answer. I wouldn't ask it if I thought there was, it would be way too boring. But like the question still remains is how do we address that? How do we, through, I don't know, I'm hearing community engaged research approaches and different approaches, though, like really get at the heart of what this othering is, which I imagine part of it is racism and bias. But how do we, the people in the chat have said, like our last commenter here, Emily Bogdan said, you know, she works for the Correctional Association of New York, and during a recent monitoring visit, spoke to union representatives who expressed negative views about eliminating solitary, while incarcerated people and activists are in favor of that. Like, how do we start to align these interests when the research shows that this one practice incredibly negatively impacts incarcerated people and increases risk of PTSD and suicide even after release, but also negatively impacts the health, likely the physical health, but also mental health and well-being of correctional officers? I think it's a hard question, but I wonder if people have thoughts.
Well, I just want to push, Lisa, two things on the framing, because I think solitary is a good example. You said the studies show that it has a negative impact on the officers who work on solitary. Are there studies that show that it has a negative impact on the safety of officers who work in the general population? Like having solitary as a place to put someone who does something violent to another incarcerated person or to an officer, putting them in solitary, does it actually make you physically less safe on the job? I'm not sure there's evidence that it does. So the long-term health impacts on the person working in solitary is one thing. The day-to-day, what do I do with this violent incident here, it's a real question. And I would say the answer is, and you know, we have people who have run prisons, jail systems, so they know this way better than me. We often ask, like, what is the answer to the officer who says, okay, that person just stabbed another incarcerated person or sliced the face of an officer. What are we going to do with them now? Like, what will the answer really be if it's not put them in solitary? Give me a good answer about how I will keep myself, my partner, and the people who I'm supposed to be managing here. How will I keep them safe? And if you have that, I think there'd be an openness, but by and large, there isn't a great answer to it. So I think the solitary one is a really complicated one because it doesn't feel good to anyone to put someone in a cage. We know that. We know it has terrible impacts on them and the person who's been caged. So we could all agree with that. But the answer, and I would say it's a good case, Rikers isn't even a perfect case. You have people working triple shifts and the violence is way up. And the big intervention is eliminate solitary. That, like, if I was working there, I'd be like, what are you talking about? Like, it's unsafe here. People are getting stabbed all over the place. I have to work 3 shifts in a row. And your big idea for me is to eliminate solitary. Like it's a non-starter. And then I just add one more complication on race. Of course, our system is premised on all the racism in our country's history and modern day practices. And as you said, Lisa, it has the complication that, you know, we were just talking to someone in probation. Majority of probation officers in New York State are African-American women in the last 10 years. But that doesn't change the racist nature of the system, but it does feel weird to them, for sure, that you're telling them they're enforcing a racist system. And I would say that's even true for the white officers, right? They are seen as the tip of the spear of enforcing slavery, Jim Crow up to today. That's what they go to work every day to do. And if you tell me that that's my job, then it's not a very generous place from which to be like, I really want to do something different. It's like, okay, you're blaming me for enforcing American racism. Okay, I guess that's who I am. And that's my lot in life. So now I'm going to do that. And I think on how we get them out of that race box and how we get them out of the I'm just not safe box. Those are two major hurdles that the general discourse about why ending solitary is good and why criticizing the system as racist is important, both actually cut against the flexibility I think we want from officers in helping to invent solutions. And I'm sorry if I just lost all my new friends on this call.
You did not lose any new friends on this call, Simon. But one thing that I want to just highlight for the group is that in my previous question, I was asking about, root causes, and we all struggle to think about like what we can do to really challenge the system. And I want to, put this out here for the group as something to think about. From my vantage point, and Lisa, this speaks to what you were just talking about, fear is at the root of correctional systems. Fear is what prompted us to have the American carceral system that we have. And fear is also what drives many of the policies and practices that we have, such as solitary confinement within correctional institutions. Our response to that fear has been to implement greater controls over people, over staff, and over people incarcerated. And what we've been talking about this whole webinar is the outcome of what that control has done. It has actually eroded safety, and it has harmed people in ways that lives have been lost. What if we approach our fear, once we acknowledge that that's the reality, from a different vantage point of connection, helping people to really see people as people, and to help mentor and shape the decisions and the behaviors that we as people exhibit. And I want to give an example of solitary, because that is a hot topic, right? I don't think anyone would say, whether you're talking to someone who's been incarcerated or a staff member, I don't think you will hear anyone say, let's do away with solitary confinement today. Let's open up the doors and let everyone out. At least you won't hear that from people who have been inside of a jail or a prison. What you will hear people say, though, is that what we have established as solitary confinement is so inhumane that there is no way that the staff member working in these areas or the person incarcerated in these areas can feel safe. And we know that they aren't safe. Incidents are through the roof, even in solitary confinement. And what we did in Cook County during my tenure was to look at when someone engaged in a disciplinary infraction, whether they attacked staff or they attacked someone else who was incarcerated, we, one, minimized the number of people who went into segregation. A lot of people go into these places, are placed into these segregated housing units for small things. And so decarceration was one thing we had to do for solitary confinement or segregation, eliminating the number of people there. That helped staff to feel safer. The numbers were more manageable. And then we engage staff in thinking about how they could serve as role models or mentors to people who were confined in these solitary confinement units to help them to make better decisions. That deteriorating the separation between people incarcerated and staff proved beneficial to us, because people incarcerated who were engaging in violent behavior were no longer just feeding off of each other. They were feeding off of positive role modeling from staff by having conversations with people who've been where they've been, who have seen what they have seen, and who have also experienced trauma, and having real life conversations about how they manage it. And then slowly increasing interaction between people incarcerated with each other, so that we can begin to eliminate that fear that they have of each other oftentimes. That also helped to decrease the fear that staff had of people who had done some pretty heinous things, because they got to know them as people, and vice versa for people incarcerated. And what we found over time was that incidents dropped dramatically. Why? Because no one felt the need, or not many people felt the need to use these or some weapon because they feared what might happen or they feared what the other person might do. It started to elevate this notion of trust that we have all talked on this call about, what is necessary in order for us to really turn the tides here. And so I wanted to just give a brief example of what we are talking about here in a real sense, and how we can implement it within institutions, but more broadly in this work that we are pushing for reform. It's engagement with people who are experiencing it and having them to be a part of it, and also implementing practices and policies from a position of humanity instead of the fear that we often do.
Can I jump in and comment to that? I love what you just said about the fear. It's kind of ingrained in our culture in corrections. You know, our system is based on it, punitive and fearing, you know, from the aspect of deterring people from, you know, becoming incarcerated. You know, the whole system is based on it. From kind of a broad level view, one of the things when we were implementing our staff wellness program was we encouraged administration to look at policies that perpetuated fear amongst staff, or practices that perpetuated fear amongst staff. And really, how can you expect them to depart from that way of thinking in their interactions with their offender population when you are perpetuating the same culture onto them administratively to the staff? And, you know, we've all heard the expression, we like to use this a lot in Illinois when we talk to staff, is that hurt people hurt people. And if you're expecting a different outcome in their interactions with the population that they're interacting with, if you are expecting them to be able to navigate the role conflict and the role, you know, switching that they have to be, you know, these officers often tell me, well, sometimes I'm a counselor, sometimes I'm a tutor, sometimes I'm a mentor, sometimes I'm an officer, sometimes I'm a RoboCop, and sometimes, you know, sometimes I'm paramedic. And having to constantly change in those roles, but act in a way where they have compassion, I would just ask, you know, do your policies reflect that towards the staff as well? Or are they based on heavy-handed, punitive punishment for policy violations, or investigating, you know, every tiny little thing? I think that's one of the challenges that we've had with suicide rates amongst correctional officers, is the fear of being under investigation. And even if you're cleared, you kind of got that cloud hanging over you, and people talk about it for years, and your colleagues remember when, you know, they were called in and they were asked about you, or whatever the situation may be. I've seen people's lives and careers ruined. And even if the investigation comes out unfounded, I've seen officers that I was working next to changed forever. And it really colored their interactions with staff. It colored their interactions with the population that they were serving. You know, one of the other policies that we've looked at that really kind of perpetuated that fear was leaving officers on continuous watches for double shifts for months on end with somebody who's very seriously mentally ill, and constantly having their family threatened while they're looking through this window and being screamed at. And, you know, if I get out of here, all of the many ways that I'm going to torment you. And so one of the things that we've talked about is, how long should the same staff member be interacting with that level of individual? And so I just want to echo, I'm really glad that you brought that up, is that from a staff wellness point of view, I would just ask the group collectively to think about what practices and policies are in place that are perpetuating it, not only towards the population, but towards the staff. And so that was one of the things that, when we were getting going, was we started reviewing policies that we felt like were really a deterrent to wellness, were a deterrent to the positive interactions with the offender population, so that we weren't going to keep this cycle, the cycle of people hurting people going. And it's a long journey, and I won't pretend that we are to the end of it. But I think that just simply grasping that concept, that we've created some of this culture amongst our staff, and we're standing back and we're wondering why the resistance to eliminating restrictive housing. We're wondering why the resistance to this change or that change. And that's because they haven't seen that reflected in their own interactions and policies that are governing them.
Can you give us just a couple of concrete examples, Stephanie, of those sorts of policies that others on the call can think through wherever they are?
I think one of the policies that we looked at was just a simple investigation policy where not informing staff when an investigation is complete, or even if they are under investigation. We've had a couple of suicides that have been directly tied to a belief, a paranoia, or an actual being under investigation. But, finding out later that it was maybe nothing of significance. It was maybe something that was really routine. So one of the things that we went back to was our cadet classes. And we started educating them, again, through kind of a modified curriculum with Desert Waters for new hires, is this is what investigations look like, and this is something that we do at our agency, and these are some do's and don'ts. And this is, here's some great examples of, if you feel like you are under, some scrutiny or whatever, follow policy, and here's what those policies, just taking it back to the education level. But then one of the other things that we try to, again, these are all under revision right now too, so I don't want to speak to their completeness. One of the other ones that we looked at was checking the box on the range card that you'd sought mental health treatment in the past 5 years. Staff had a belief that checking the yes box on that was an automatic termination. So really going back to, well, what does our policy say? And educating, myth versus fact. So we really went on a huge education campaign to a lot of misunderstood policies, or policies that may have just needed revised. And we went back to the table and we revised those policies regarding inpatient mental health treatment, regarding utilizing it. We had a lot of staff that thought that just the act of calling EAP would get them written up or get them referred for a fitness for duty. And so just a lot of this stuff was just going back to education campaigns and undoing a lot of culture myths. So that was huge for us.
Thank you.
I would like to jump back here and back to that topic of solitary confinement. I think that a lot of the debates in Canada and in the United States about solitary confinement and the change, potentially the abolition of solitary confinement, I think that those debates, they don't realize what's going on the ground. And what we get, at least in our research, is that like 90% of the correctional officers that we interview, they tell us, look, I came to this job because the pay is okay and because it gives me the chance to change the world. We hear that like in pretty much every interview. And actually, like we hear more the idea that they came to the job because they want to change the world, they want to do some good, they want to help like change this world somehow, and even a little bit less about the pay. But anyways, but the debates about the solitary confinement, they ignore that. They ignore that aspect. And they kind of, they treat officers and inmate, it goes back to the conflict, right? Like inmate officers, it's just like there's this huge conflict, which is, we don't see that in the reality. The reality that we see in Canada, and probably this is from what I heard from Wendy and Simon, is the same in the United States. I mean, or at least in Illinois, right? So it's like, so for us to kind of think and debate solitary confinement, at least, the way that I see here is that we need to have a serious discussion. Okay, what are we going to do with mental health of the inmate, of the prisoner? Because a lot of the prisoners who end up in there, they have mental health like disorders. And the correctional officer has no resource. What you do with someone who is in the middle of a crisis? That's one problem. The other one is, what do you do with like inmate or prisoner on prisoner violence? What do you do with that? I mean, you have to address that somehow. And the system doesn't give the correctional officer any kind of tool for that, like other than, you know, the solitary confinement. And the other problem is, what do you do with like prisoners who assault officers? Again, there's nothing, like there's no other tool. So I think the debate about potentially abolishing solitary confinement, we have to account for that reality on the ground, the reality that officers, they're there because they, I mean, you know, like they want to change the world. It's not because they want to abuse people, right? So it's kind of changing that kind of narrative and looking at looking the ground, what's happening on the ground, without having this, I mean, any kind of conversation or discussion, even about trust building, it goes nowhere. Because I mean, the reality is, you are there, you have a prisoner who is assaulting someone, or who is in the middle of a crisis. What do you do with that person, right? So we need a solution for that. Yeah, please.
No, I agree with everything you're saying, and also I would say that for the past decade, we've talked about reform. I can tell you firsthand that corrections officers did not hear themselves in that conversation, did not see themselves in that conversation. All they heard was how we should recreate or rebuild, restructure a system that was going to be healthier and friendlier to those who are incarcerated. I'm not saying that's wrong. But what I am saying is that this system, that was a blind spot for reformers. It just was. And we as corrections leaders just didn't do a good enough job bringing our members and our officers into that conversation on the front end of it. So now it appears that everything that's being talked about is scary to them, and it worries them. And when they hear a prison's going to close because we're decarcerating, instead of like, we should all be celebrating that. That's not the case at all, because it's a total threat to them, because they have not been educated or brought in a way. And even today, even dealing with COVID, we are still not prepared as a nation to figure that out in a way that brings all of those affected into a conversation of solution. That is just the tip of the iceberg. But also keep in mind that all of these things, when it comes to segregation, when it comes to all of the other things that we know is unhealthy and that are killing people on both sides of this, we still have not acknowledged them in a way that says, when we are thinking about restructuring a system, they should be like, it's always about, it's called inmate reform, it's called corrections reform, it's called, like, we've got to change some of our terminology so it's more inclusive, so it sounds like that up front. So I don't have to go out there to corrections officers and try to convince them, like, no, this is really going to help you somewhere in this as well, right? It shouldn't be that I have to convince them of that. This should be when they come into this, they're seeing, they're hearing, and they're acknowledging that they have an agenda in this too, right? And that agenda should be talked about by reformers as much as doing away with solitary confinement's talked about. The wellness and how we get at that should be talked about too, so they can see where that connects, so they can see that this is a place that affects everyone. So I just wanted to add that to your last point.
Well, for everyone participating, we said that we were going to get to some solutions, and I'm happy that at least for the last few minutes, that's what we've been talking about. I want to take a moment to just summarize some of the things that we have discussed as a group, and then to open it up if there are other solutions that we should be sharing with everyone participating in this webinar. So when we think about the transformation that is needed for this carceral system, the American carceral system, to be more health promoting. What we've heard is a resounding bringing people with lived experience to the table, being more inclusive of staff as well as people incarcerated to collectively forge a pathway forward. We have also talked about the benefit of starting that conversation with wellness, because we've talked about the universal experience of circumstances that are eroding the health and wellness of people incarcerated as well as staff. We have also talked about the need for a deep review of policies and procedures. Thank you for that, Stephanie. For the policies and procedures that perpetuate fear and perpetuate otherizing. I would add that we should also do a deep review of the training that staff go through that sets them up for that otherizing and to start their work from that position of fear. And then we've also talked about the value of using data to really show progress. You know, Simon, you talked about like the difficulty with correctional staff engaging in this work because they don't necessarily see, you know, what the safety measures in it for them will be in the future, like what the future will look like. And I think that what we heard from Rose and Marcella is the value of data in helping people to see the progress that is being made, even when they can't see it in front of them and even when they can't feel it, to keep people engaged in this work. And then we've also said we have to have frank conversations and tools about violence that happens in correctional facilities and how we can best support staff as well as people incarcerated to challenge that violence that happens. And we've given some examples around solitary confinement. Are there other tools and transformations that we need to collectively look at to make some of the adjustments in this system?
Just going back to the data part, I think transparency from like the correctional services, like correctional services telling us, okay, how many officers were killed in the line of duty, assaulted, raped, not only obviously prisoners as well, but officers as well. So
I think you hit you hit a lot of the highlights in terms of solutions. I just wanted to mention, I think there have not been enough spaces, and this is not easy to do. You'll all see that quickly, where formerly incarcerated people and corrections union leaders, corrections officers could actually be in the same space together. Right? There's all sorts of code, let's say, about why they can't be, but you know, they actually need to like meet each other. You know, and some of the conversations I've witnessed Andy have with people who were incarcerated in the prisons where he worked, like it's like they speak a whole language, right? They shared decades of an experience that I don't understand, but that almost never happens. And so it's easy to do the otherizing and the they're not human or they're monolithic. So there's some convening power. I think everybody here, you know, and everyone we talk to, when I, you know, everywhere I go, I'm the annoying person who's like 3 suicides every week. Like, really? But like the narrative about corrections officers is Shawshank, right? That's what it is. And we can change that by, you know, introducing their humanity, just the way I think we all work hard to, you know, people on death row, as Brian Stevenson likes to say, are better than their worst act, right? And so, you know, corrections officers, yes, there are some bad apples, just like there are on Wall Street, but we haven't demonized all of Wall Street. So I think there's room for us to help change the narrative. There's a huge amount of research. I mean, obviously the research you're doing in Canada is awesome. I was like, we want more, but I think because we have researchers here and because of Yale's role in this, like, I just think it's a black box. You know, we're told again and again that the staffing ratios are like 12-1, but if you ask any officer, they're like, it's 100-1, it's not 12-1. And then you hear in Norway, it's 6-1. You're like, well, give us 6-1 and you could transform the system. But I don't think we really know anything about what happens and how many people are really working triple shifts and all the stressors on the system. I think there's been some good research, but it's a big country. We have a huge carceral system. There's a lot to be studied, and there's plenty all of you could do, I think, to help with that. And then, as I think you already summarized, there's obviously policy stuff that makes a real difference. And then I don't know where culture fits, but there's something about, it's okay not to just be so tough all the time, right? And I don't know how you change that, but that feels like, because in some of the settings, and I'll be quiet, in some of the settings, Andy and I have worked with corrections officers, you ask them to share a story about a proud moment, and they talk about doing something for someone who's incarcerated, and they start to cry. It's like but it's because it's so close to the surface, because it's so bottled up, right? And I just think more spaces that allow that caring to happen and let them admit it. Andy always says that corrections officers never see success. They literally never have contact with anyone who doesn't come back. All they see every day is the 77% of people who recidivate, whatever numbers you choose to follow. So the only lesson they get is that this is chronic, right? There's nothing but chronic criminal here. Nothing hopeful about someone who turned their life around, and they're not allowed to be in touch afterwards, even with someone who they coached and who's now successful. So anyway, thanks for having me.
Can I just jump in just for 1 second, because there's just a couple of, I think the transparency has a lot to do. Anytime you have transparency in any system, real transparency, you're gonna reduce, right? Whatever corruption is there, or whatever other things that might linger that need to be looked at, studied, and solved. It gives us an opportunity to realize and to recognize the places where things don't work up front, and how we can best fix that. And then I have a dear friend of mine that was a retired corrections officer that's listening. And he wanted me to just point out the point on transparency should be adjusted to afford for our input to what information is gathered. So it's super important, right, that information that's gathered or given is accurate, and we should have the freedom to comment on that without reprisal, right? That's true transparency. So thanks.
I just want to add really quickly, I think it's really important that when we talk about populations and subpopulations that we unpack the nuance. Like, there's a lot of things that have been said, like communication, prisons, each prison is a society in itself. And I'm kind of looking at you, Andy, in hopes that you agree, but it's a society, it's got its own structures, it's got its own everything. There's cultures. You can't have guys working the unit. Those odd bad apples are few and far between. You're working on a unit. I know that you see some prisoner that you kind of like getting beat up, and you kind of feel bad because you're like, he's a nice guy. Like, it sucks to see this happen to him, right? It's really nuanced. There are relationships. It's not always, and you have to be stoic. You get trained really quickly to be stoic, because you can't be working with an offender and the offender then tells you something horrible and you start crying. That's not going to get you anywhere, because you're not going to be there for that person if you're emotionally reacting. It's no different than calling your employment assistance plan and telling your psychologist that something's going on and they're crying for you. It's not really providing you the support. So it's a really nuanced profession. It takes a really nuanced person. And I think we just have to be really careful that we're not painting people, even accidentally sometimes, in the way we talk about it. Because the way to make change in this is trauma-informed lenses, building trust, more communication, de-escalation strategies, recognizing things that are supportive that don't have to be harmful, the pros and cons of the needle exchange and how to implement something like that without harming staff, right? Consultation, frontline views, understanding, consultings with both the voices of prisoners and the voices of staff. Like, there's a lot of things that need to be done that are really progressive way forward. And they're nuanced and they're complicated, and they're going to take a lot more listening. And I always kind of try to approach it with a lack of knowing and see where they bring me instead of my own assumptions or what I've learned previously. And I just think that that's a really important point, that is a way that we can move forward. That was it.
Thank you for that. Thank you to all of our panelists. I see that we're exactly at time, so I'm going to wrap us up now, but our hope here is that this is just the beginning of a conversation, and it's a conversation that's been had before us, and hopefully will continue. Hopefully there will be some new aspects to it, but in really thinking of transformative practice change that is nuanced and is localized, but also more broad, And we're talking at the policy level, at the labor law level, and then even at the micro kind of organizational psychology level at the microcosm of the jail or the prison. We've heard a number of avenues to try to get there. And I think it's a package, right? Like it's going to take lots of things. There's not a singular solution, as we've heard from everyone today, that Dr. Jones-Tapia summarized for us really well. This is a field for really extensive research. I think we are researching the tip of the iceberg. And in terms of occupational health and wellness, there is just so much deeper to go. You all are doing exciting work, people on this call, and really excited to have connected with community members through our participants and through people who watch this afterwards. For our panelists, there are a couple of Q&As on there from international audiences. And if you have a moment to answer, that would be great in the Q&A. Otherwise, thank you. Thank you for the work you're doing. Thank you for the conversation and for making all this time to be with us. We've already shared with participants how to reach out with questions afterwards or to contact you. And we look forward to following this up with the webinar in the future to hear updates on all the great work. So thank you all. I'll stay on for just a moment in case there are other questions.